On Tuesday, the Health Secretary ran around UK news shows giving this justification for the government's plan to strip NHS doctors of their democratic right to strike, force them to work against their will, and allow them to be sacked if they refuse.
One of the problems we've experienced is, if I just take August, when locally NHS leaders and BMA representatives agreed a number of exemptions, but then because of the militancy of the National BMA Committee, they refused to agree what had been agreed locally. To refuse exemptions that had been agreed locally by their own representatives, as we saw in 17 cases in August. One of the things we saw in August was, even where NHS leaders locally agreed with BMA representatives locally to have exemptions for time-critical care, the National BMA Committee refused to actually agree with their local representatives.
The Health Secretary is claiming the BMA blocked locally agreed strike derogations, and his claim immediately led to headlines like this one in the Telegraph. Doctors' Union blocked patients from getting care 17 times during strikes, says Steve Barclay. And this one in the Daily Mail. BMA accused of increasing militancy and blocking patient care during doctors' strike. But just like everything else this government says, it was completely untrue. In a letter to the Health Secretary, 5 local negotiating committee chairs with first-hand knowledge of 12 of the derogation requests Mr. Barclay referred to say this is deeply disingenuous. A key strand of your justification was a deeply disingenuous claim that 17 derogation requests escalated to the BMA for consideration during August industrial action were agreed locally beforehand and then refused at a national level. As the LNC chairs involved in 12 of these requests, we can tell you it is categorically untrue that any agreements were made locally. We would urge you to retract your claims about past derogations and set the record straight at the earliest opportunity. Failure to do so will demonstrate that the case for this legislation and introducing mandatory minimum service levels is built on a deceit. Well, there you have it. The BMA says it's categorically untrue that any agreements were made locally. So what the Health Secretary ran about telling news shows on Tuesday was once again just complete bollocks. If an NHS trust has a staffing issue that they believe could lead to a patient safety concern, then they escalate this through an agreed NHS England BMA process so the validity of the request can be assessed. And the Health Secretary knows that. So it appears the government is again attempting to devise a false narrative in an attempt to justify introducing further anti-trade union legislation, when we already have some of the most restrictive trade union legislation in the developed world. And let's not forget, patient safety is at the heart of the BMA strike action. Wednesday's junior doctor consultant strike is a Christmas Day cover model of strike action. So who are we going to believe? The NHS doctors who sacrificed so much to keep us safe during the pandemic, or a government that lies about practically everything? This government's treatment of our NHS doctors is an absolute disgrace. The Health Secretary needs to retract these claims, set the record straight, and stop attempting to demonise those caring for patients.